Hello, I'm Dr. Mariam Awada, board certified plastic surgeon for over 23 years. I've been here at Michigan Cosmetic Surgery, located right here, Southfield, Michigan, Metro Detroit, Oakland County. I grew up, born and raised in Michigan. I left here to Texas for my training and residency program, which was to train with the best plastic surgeons in the world at UT Southwestern, which I'm forever indebted to. Today I want to talk to you about one of the most requested procedures in our practice, breast augmentation. I see many women who desire breast augmentation because of simply their petite, and their breasts are too. And they want to have more of an hourglass shape and look good, whether it's their business suit or their bathing suit. And they typically majority of people want something natural. Rarely do I see someone say, oh, I want double Ds, and we have the long discussion about how that's unhealthy for you. But most people, they come in, they want added volume. Some people want to restore their volume. Some people want to enhance their symmetry. Some people had breastfeeding changes. So they might have a little sagging or a little nipple asymmetry, and we try to nip and tuck just very simple and keep things as limited incision as possible, sometimes even doing scarless breast lift. But that's where you come in, whether you're in your 20s or 50s, and we help you through the entire process. So I don't want you to think that you need to come in and tell me what size you want to be and that's what we're doing, because that's not how you're going to help. I hope you read my breast augmentation book. I took time to read it because this is impossible to tell you in an hour, and it's really important to me that I educate you, because I find that my educated patients are the happiest patients as well. It helps for us when you come in. I'll go over your medical history. I'll understand what your goals are. I'll learn about your prior pregnancy changes so I can gauge, in terms of your skin quality. And after measuring you, we'll take a lot of breast measurements. We'll talk about what your goals are and actually try some sizers on. Breast implant sizers, basically, I place the implant in a special bra. We try on a shirt that helps compress and shape things. So we try different ones on, and it's really quite amazing because women can accurately tell me after 2 tablespoons difference what they want to look like when it's too big or too little. And that's what I keep going up to what they say, no, this is too big. Then we go back to what size that we had picked that we like, and that's it. In terms of breast augmentation, I think that they're patients who are ages 18 to 22 that desire a breast aug. And if they don't have breast asymmetry or changes, they're able to get saline breast augmentation, which is the implant is a silicone shell, but it's filled with salt water, like IV fluid water. So if it deflates, you basically absorb it. For the last 15 years, the majority of my patients choose to have silicone breast implants, which are now gummy bear, because before they used to be more of a liquid syrup. Now they're very cohesive. So if you cut them where they break, there's no leakage. They're not fluid. So they're very safe for your body. In terms of the breast implants, we'll try sizers on, we'll determine what you like, and then we'll talk about above the muscle, behind the muscle, which is pretty simple. The majority of patients, we place them behind the muscle or behind the fascia subfascial. And typically, rarely do we go anything directly above the muscle or that's not subfascial. Subfascial with some Galaflex is what I use for patients who are professional volleyball players, basketball players, bodybuilders, patients who use their pecs every minute of every day, and we don't want the implant to be behind them because then they're just going to be, every time they flex their pec muscle, it's going to be changing the implant position. So that's why for those patients, we would go above the muscle and typically subfascial. And many of those women, I use Galaflex because that's what's going to give them support if they don't have the strength of the muscle. In terms of patients, once we try on the sizers, I think you'll be really excited and a lot more comfortable that you've communicated to me what your goals are. And I've explained to you what the risks, the benefits, not just of the implants, but also of surgery. And then we prepare you for surgery, which is pretty simple. If you're younger than 40, you don't need a mammogram, but you do need labs, which are just to make sure you're not anemic, because many women are. If you're pretty healthy, you should be able to have surgery without any further testing. If you have any medical issues, we'll consult with your doctor that you see, and we'll make certain that you're as healthy as possible so you can heal as best as possible after surgery. Some women are not sure if they want or need a breast lift in addition to the breast augmentation, or breast augmentation in addition to the breast lift. And I try to keep it pretty simple. My rule is that for breast augmentation, if you like the way your breasts look, but you just need to add volume, amplify that look, then you just want to have a breast augmentation. If you have some breast asymmetry, like one nipple is lower or higher, or especially after pregnancy, a lot of women end up breastfeeding more on their left side because they have more glands, and then that left side gets stretched out more, and then the right side doesn't budge as much. So sometimes I need to nip and tuck, but you don't need a big formal lift to get symmetry in the nipple area and where the positioning is of the areola. Sometimes we can nip and tuck and just take away, think of a crescent moon shape, a crescent shape of skin, just to kind of balance the nipples so they're not like this and they're more even and more centered. And usually I'll always try to do that always internally and doing internal lifts before I ever try to do anything externally or cut any of the skin. But even around the areola or the crescent, those incisions feel great. So it's not of concern, but I explain to people, if you're wearing a bikini or a cute bra with, a shirt that sometimes you can, see your nipple, they're not going to see your incision by your areola, which is along the dark border and the light border of your skin. They're going to see that, if your nipples aren't perfectly even. And so I think that a lot of women try to make decisions and it's based more out of fear. And that's our goal, to connect and to make sure that every decision you make is one where you're 110% confident about, and you understand why you're making that decision, and you understand that whatever decision, the outcome, the planned outcome, and sometimes patients, no matter what I explain to them, if they choose not to have a nip and tuck, even though they need one, you can always add that on. And that's not typical. I think a lot of patients come to me and they're like, oh, I don't want to lift or I don't want any cutting. I just want to add volume. And once they understand that you can get beautiful breasts with a little nip and tuck without any, like the up and down scar or the under scar, they understand, they're excited about it. They're really excited because they thought they were just going to be able to get their breasts lifted and they needed a lot of cutting, and they don't. And we can usually do a significant amount of shaping and lifting internally and externally with very, very limited incisions. In addition, after surgery, we use special dressings as well as support bra, and we get you in those things right away, in addition to doing laser treatments and silicone sheeting to help minimize any scarring and make certain that things heal as quickly as possible. As far as surgery, I think it's pretty simple. I use a lot of numbing medicine, so the pain never starts. In patients, they'll go home, they'll be a little bit groggy, but really you can go out to dinner the same day. I just encourage you to just kind of rest, relax, let yourself heal, and icing and pain medication, everyone's different. Some people take them for a couple of days, some people take them for a week or less, but usually, rarely do you ever need anything more than that. And most patients are surprised how amazing they look. You will not have bruising. I pretty much never have bruising unless it's an area where I do liposuction for the bra fat, in which case that may be bruised, and actually that's what usually is a little bit sore. But it does make a huge difference in the shaping here if you don't have the bra fat to ruin all your summer dresses. And it's not about even you being fat, it's actually hormonal fat that you just liposuction it, get rid of it, and it'll make a much cuter shape cleavage. In terms of recovery, like I said, pretty nice, easy, long weekend, 24-hour recovery. We have a fast recovery process because, as I stated, I do everything under direct visualization. There's no blunt dissection or pulling, and it is a very, very gentle dissection with a very clean process. So then also what that's going to do, it's going to limit your risk of having capsular contracture, which is scar tissue that develops around the implant, and that some people are predisposed to it, which is not typical to have that scar tissue. But anytime you place a foreign body, such as an implant, whether it's a heart implant or a stent or a breast implant, your body reacts the same. It protects yourself by placing a thin layer of tissue around the implant called the capsule. And that capsule is pretty soft, like tissue paper in most patients. And some patients, though, they keep developing more capsule and thicker and scar tissue. And that's what we call capsular contracture, because that capsule becomes very thick and tight, and it becomes like, the orange peel rind and the implant being in the center. So those patients, which are few but do exist, have other options, and those will be approached based on should you have any problem, which is less than 5% chance, even less than that, to be honest, in my experience of people having capsular contracture after their breast surgery when it's a very straightforward breast surgery. But the risk is there, and whether you're a 1% or a 99% and everything in between, whatever happens, we try to first prevent it and second, get you through it. I think people ask me what makes you rated top in the United States, and I'm really proud of receiving multiple awards over the years as the best breast augmentation plastic surgeon in the country. And I think what helps with that is, first of all, my patient education process, which is not just my book, but it is also when I meet you, I help you. But this book is great, whether you're ever going to come to Michigan so I can perform your breast augmentation, or you're interested in having breast augmentation elsewhere. And I hope you read it, because I do think it's important, and it will definitely help you along your journey and starting it out feeling more confident and knowledgeable about the procedure and the recovery. In terms of the breast surgery itself, I think once we determine what your goals are and the whole process that I go through that's very personalized, on the day of surgery, we'll go back over things. But in surgery, I take the time to put sizers in and sit you up and determine what is the best perfect match for you your body, your shape, what is filling out your breast and makes perfect cleavage and everything just beautiful. Many doctors don't do that. And what's even worse is a lot make you pick like the size. Oh, you're going to pick 300 or 400. I would never do that because even after 23 years, I still like to put the implants in and sit you up and determine what gives the most perfect match before I pick the actual permanent implant. So those are called sizers, and they're sterile, and I have a whole slew of sizers and 3 different manufacturers that I use their implants. And it really depends on the person what I choose. And then once I identify what gives me the best match, we choose the implant and place the implant. I think with my very low risk complication, my attention to detail, whether it's your bra fat, so many people have bra fat and it just ruins your spring dresses, every one of them, or those cute shirts or tank tops. And it's so nice to get rid of that with just a little poke, and I just lipo it, we're done. Also, I do a lot to help shaping the cleavage and shaping the muscle here. And then as well as I keep the muscle on the sides here to keep it more in and supported. Some patients understand it's behind the muscle, but some of the muscle is released to give it little shaping, and some is maintained to keep it pushed in and upward. And in my opinion, I think that in addition to my ability to be very, very gentle in dissection and precise, I think that's why I have amazing breast augmentation results and very, very happy patients.